One of the major challenges that hospitals are facing today, and we hear this very frequently, is it's difficult to find the right amount of clinical staff for the right amount of patient need in their community. And so Synergy Health Partners creates custom staffing programs working with hospital administration, especially in rural areas where it can often be very difficult to source and retain the clinical talent needed in that area. And we put programs together. So we often get asked, what is a surgicalist? Well, picture a hospitalist for surgery. So we decouple private practice from hospital-based medicine. The benefits are great on both sides of the equation. For the surgicalists themselves, they basically show up for 10 days at a dedicated site. They're actually integrated into the care team. And then they get to go home for 20 days and have that time back to themselves. There's no administrative hassles. There's no private practice to run or manage, no elective cases to create any care conflict between their on-call and their elective surgeries. From the hospital's point of view, there's also many benefits. They get a dedicated clinician, again, integrated into the care team. So there's that continuity of care for their patients. They get to let their local surgeons rest, take a break while the surgicalist comes in and takes all the call. And of course, they get to provide outstanding patient care by making sure that they've got those care gaps filled. So when a patient needs help, there is somebody there to take care of them. So why do hospital administrators love partnering with Synergy Health Partners? One main reason, they get to keep care local. Think about it. If there's a patient in an emergency and that facility does not have the right clinician, the right surgeon to cover those cases, what are they going to do? They're going to have to take the patient to the next closest hospital. So by partnering with Synergy, they actually get the surgeon they need when they need it to make sure they take best care of their patients in their community. Of course, from an economic perspective, the hospital administrators are happy to be able to keep that care local and keep that revenue local, both the revenue from the surgery itself, but also the associated downstream revenue that comes with it. From a patient's point of view, hopefully the process is completely seamless, meaning if there is a Synergy surgicalist that is plugging an on-call gap where a surgeon might not have been able to see that patient, they will never know the difference. And that's the beauty of the model. Our surgicalists are integrated in with the care team and will see patients as if they're their own. The transfers and handoffs and follow-up care will all be smooth and seamless as well. And our surgicalists come back to the same facility each month. They don't rotate through like a locums. They actually are dedicated to that account. So they become an integral part of that community, and the patients get the care they need when they need it most.